kind of need to go through in a little bit of order. Okay. Ms. Matas, can you start us off with tendonitis?
Sure.
Thank you, Ms. Matas. I appreciate it, madam.
So you assigned tendonitis to me, and basically what it is inflammation of the joints. The condition causes pain and tenderness to the touch, and it makes it difficult for the client or the person that has it to move the affected area. It usually occurs on the shoulders, elbows, wrists, and or knees.
That's true.
And to treat tendonitis is just recommended lots of or plenty of sleep and avoid moving the area. And it can also be iced for about 20 minutes every 2 to 3 hours.
Yeah.
And the client could also wear like a brace to tighten up or compress the area. And I, as a massage therapist, would massage my client.
Probably, yeah.
But it would be the preference of the client,
Yeah.
the pressure, and the comfort level.
Yeah.
So I would communicate with my client often. Well, not often, but maybe 3 times throughout the massage session.
Well, most massage sessions, when they don't go right, it's because of a communication issue. So that's great to hear you say that. It is, you're absolutely right, by the way, it afflicts joints usually. Because of, it's inflammation of what specifically?
The tendon.
Thank you. It is inflammation of the tendon. Itis means itis, and itis means itis. Oh, geez, sorry. Really, itis means inflammation. Tendon means tendon. That's what I was trying to say. Inflammation tendon. Well said, Ms. Matas. And by the way, my only words of caution for you guys are if the area looks swollen, I probably wouldn't work at them. But if they've got tendonitis, actually massage can be helpful. Just don't go to town on it the first time, right? Try it a little bit and see how they are feeling next time. But I agree with her. Really good. Okay, so if anything, a local contraindication might not even be that at all. It really depends on the situation. She's absolutely right. Well done. Thank you, Ms. Matas. Ms. Lobitz, tendinosis.
Yes.
Can I interrupt you for 1 second? I'm so sorry.
Sure.
Guys, some of these what might be very short presentations, even if you did a good job. Just trust me. Some of them are just a definition or whatever, so don't feel weird if you're like, oh, that's been already kind of covered or whatever. Go ahead, Ms. Lobitz.
Right. Tendinosis is a degeneration of a tendon when the collagen breaks down. Symptoms include pain that gets worse during or after activities, stiffness or restricted movement in a joint, or pain that persists for several months. So it can be caused by chronic overuse or repetitive movements without allowing time to heal. It can also be age-related as tendons lose their elasticity. It's a common condition in the wrist, elbow, shoulder, knee, hip, and Achilles heel tendons. The tendons can heal, but it can take a long time, anywhere from 3 to 6 months, because tendons are avascular and collagen production is very slow. Massage is a form of treatment for tendinosis because it helps promote circulation to the affected area, and our book actually mentioned that deep friction may stimulate collagen production. So as long as you communicate again with your client and there's no swelling, get feedback from them, it should be okay to massage the area.
Really nicely said. So to us as massage therapists, tendonitis and tendinosis seem very similar, and we respond to them very similarly. They are very different in the sense that tendonitis is inflammation of the tendon. Sometimes tendinosis starts out as tendonitis, but tendinosis is actually degeneration of the stuff that makes the tendon strong, which is collagen, and that's the steel-like fibers in that fascia degenerating. But because it's highly avascular, as Ms. Lowitz just said, it really responds well to being rubbed and getting blood in there. And again, you just check in and don't work on that area for an entire hour. Work on it for a little bit, and then next time you see them, ask how it feels. And if it's the same or better, do more of what you did last time. That's a really safe, straightforward thing to do. Nothing to worry about. And if it didn't feel better, then it becomes a local contraindication. If for some reason they're like, oh, it kind of swelled up after you worked on it, Well, it's probably a local contraindication, not something you should be messing with. But you won't have done any major damage at all. I should say, you won't have done any permanent damage. Miss Trotter, will you tell us about de Quervain Tenosynovitis? And will you say it 10 times fast? No, I'm kidding. Don't do that.
I will do my best. Okay. Sorry.
Don't be sorry.
There we go.
Nothing to
I
apologize
know
for.
I always have my PowerPoint.
Oh, of course, a PowerPoint. Good. I like it. And
So it's Tendinosis, Tendinosis, something like that.
I've heard de Quervain Tenosynovitis. Yeah.
Yeah.
Anyway,
Yeah.
good PowerPoint. Keep going.
Oops. Yeah. Where's the little thing? How do I go back?
You
I
can't
messed
use,
this up now.
that's all right. You can use the arrows usually to go back.
Yes. Okay, so it's also called Radial Styloid Tendinosis, too. And it's painful like condition that affects the tendons on the thumb side of your wrist. It will hurt when you turn your wrist or you grab anything, if you're writing, texting, or if you make a fist. It can also happen if you oh, that was supposed to be on the spot. But it's so what causes it is if you overuse your thumbs. So if you hairstylists, they have this problem a lot. Golfers or people that use computer mouses a lot, so people that do desk jobs. And then my guess is it also can happen to massage therapists if they use their thumbs too much. I might be wrong because I didn't find that anywhere, but I was thinking about it later, and I was like, it could probably be something that can cause it. The main symptoms are pain or tenderness in the wrist, often below your thumb area. It normally gets swollen. Most common treatments are medications, so the type that's supposed to help with the swelling. So I believe that's Advil or Tylenol. Then physical therapy, and in rare cases they would recommend surgery. But generally, if you catch it sooner, it won't get that bad to that point. Yeah. And you can also massage the area if it's not too bad, how some other people said before, if it's okay with the client and it's not causing them too much pain when you're massaging them, you can definitely massage the area, just because it can be a really sensitive area for some people, and depending on how bad it is, it can be super painful. And then here's some pictures kind of showing it more, just so you have a better idea. And then the one where the person has it in the fist and they're bending it down is kind of a test to see if you have it.
Yeah.
So if you make a fist and you bend your fist all the way down and you start feeling pain in that area by your wrist, then it could be possibly that. So.
Yeah. Well said.
Okay.
Nicely done.
Yes.
Thank you.
You're welcome.
Miss Suriel, you have your hand raised?
Yeah, I have a question. So yesterday when you posted the all these that the class that we were gonna give,
Yeah.
I took a picture and I don't know if you can see it, but my name is Tenosynovitis, the one that Mr. Schlatter just said.
Yeah.
So now I don't know what am I gonna do.
Well,
what
guess
was the mistake?
if you have anything to add, you can add. But
No, she
okay.
was very.
Well,
good at it.
then Miss Trotter just got you an A for the day. Bam! Boom! Yeah.
Okay, sorry. But I was like, what am I gonna do now?
Yeah, you're just apologizing for me making a mistake, but thank you. Anyway,
No,
no
that's
worries.
fine.
You can't fix that. And I think Ms. Trotter's presentation was as good as two people could have done. So
Yeah, it
we'll
was
take
great.
yeah. So everybody,
Thank
by
you.
the way, it's inflammation of a thumb tendon. It's usually up on here on the side of your on the side of your wrist. And what's kind of interesting is the reason it's sometimes called radial styloid tenosynovitis is because this is your radius, right? Remember the radius goes to the thumb, and there's this little bump off the end here called the styloid process, and it gets caught up right in here, and so they often will call it radial styloid tenosynovitis. It probably does, Ms. Trotter, affect massage therapists, but the reason it affects hairdressers much worse is there's something about holding stuff out like a hairdryer here, and the weight of it pulling down on the side of my arm in neutral position. Luckily, massage therapists don't do that. Don't get me wrong, we got plenty of other problems, and I'm not saying it wouldn't affect one, but that's one of the reasons it has. People use a hammer too, it affects them a lot because this is just too much action to the side here after a while and it gets worn down there. Really well done though. Thank you. It's local contraindication at the most, and actually you can probably massage it, and you could definitely hit all the thumb muscles up in here that we're going to learn about later to help relieve pressure in there. And a lot of times when I have something like this, by the way, everybody, I start massaging where it's okay with them, where it doesn't hurt, and I slowly try to work my way into the hurt area. And each session I try to go further and further into the hurt area, actually. And after a while, all of a sudden you're working right on the spot. It's just gotten that much better. So I always like to start out where it's not hurting and start to circle in as close as I can to where it is. And I stop when we get to whatever point. The next session I try to go in further, that kind of thing. Cool. Thank you, thank you, thank you. Ms. Suriel, by the way, I'm sorry, that was not intentional, but I'm glad you laughed and it's okay with you. So good. Okay. Ms. Hawks, Fibromyalgia Syndrome.
Yeah.
Yeah. This is a big one.
People with fibromyalgia syndrome experience pain at a lower threshold. Some symptoms of this are going to include tenderness in localized areas called tender points,
Yeah.
widespread pain, joint stiffness, fatigue and poor sleep quality, and mood problems. So possible cause is an imbalance in the way that our nervous system responds to stress.
Yeah.
Often found in people with fibromyalgia is a high level of substance P.
Substance
So
what?
this is it's a neuroreceptor associated with pain signal transmission.
I didn't know that.
So diagnosis is made after a 3-month history of widespread pain among the other symptoms. Pain is experienced when 11 of the 18 defined tender points are compressed at a standardized amount of pressure, which is approximately 4 kilograms.
Yeah.
And the symptom affects 5 million American adults, and women account for 80 to 90% of that diagnosis.
Yeah.
When massaging, your massage should be tailored to how the client is feeling, which can vary daily. So it's very important to check in on pressure. The book says that they recommend keeping pressure below a 5 on a scale of 1 to 10. And massage is highly recommended because it's going to decrease that level of substance P, and it's also going to help relieve some of the pain that they're feeling.
Yeah. Well said, Ms. Hawks. Well said about something that it's hard to tell if it even exists. And I do not mean for a second that people experiencing fibromyalgia are not in pain. What I mean is this is one of those weird conditions where they have no idea what causes it. They don't even know if one person having fibromyalgia is the same as another person. So what they did was they created a disease by describing the symptoms. And the symptoms are soreness, often in like shoulders and hips and things like that. Now it's chronic soreness. And it's muscular and fascial soreness. It's not a joint soreness. And massage is the only thing you can do for it. It's the only thing. They totally prescribe massage. You guys will definitely have people say that they have fibromyalgia. There is no concern with working on them. Ms. Hawks was correct. I mean, checking with them about pressure. Some of them really can't take a lot of pressure because they're hypersensitive, but some of them like a lot of pressure, and they'll tell you, yes, it hurts, but it's a different hurt than I normally have. They've got this ache all the time, and they prefer the massage hurt, and it makes it feel better. So I think they're really experiencing something. That's not what I mean. But they literally could be experiencing stress, and we've labeled it fibromyalgia. So if somebody comes to you with fibromyalgia, it's a massage. Totally. I mean, don't tell them that, but it's a massage. And they might be a regular client and they really need you. And it's, yes, it's definitely stress related. I mean, I don't know if that caused it, but it makes it worse. So the massage lowering their stress too tends to help. And because they are in constant pain, they tend to be tired and things like that. But you're just, I mean, I can't tell you how many clients I've had that were diagnosed as having fibromyalgia. But to me, it was just massage them where they want to be massaged. Yeah, good stuff. Very safe. Very great. I get excited about stuff like this. Now, I don't want anybody to be in discomfort ever, but these are prime clients. Like when they come in, they say fibromyalgia, I'm like, cha-ching! Like, I'll be seeing you 3 times a week because you're going to love me. That kind of thing. So it's great for that. And there's nothing to worry about too. Very cool. Thank you. Thank you, thank you, thank you. Hey, Miss Walker, I'm sorry. Miss Walker, why? Hello?
Hi.
Really quickly, what are you grateful for today?
Today I'm grateful for the weather because it was nice out.
Thank you, ma'am. Thank you, thank you. Okay, Miss Estes, myofascial pain syndrome.
Okay.
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 Myofascial pain syndrome, MPS.
Yes.
So it's a muscle pain condition. They say it feels like trigger points, like pressure on sensitive points in the fascia. And it typically occurs after it's been like contracted repeatedly. So, obviously your job, if you're on a computer, something like that, hobbies, any sort of stress. And it's different than a regular knot, if the pain persists or gets worse over time. So, it can feel like deep aching, or a tender knot, or you can have difficulty sleeping. Okay, so for massage, we as therapists need to address the underlying problem, assess and address it before we can work on it. So if it's something like occupational or like they did, like say raking leaves, then, we could probably work on that. But if it's something where it's like limiting the range of motion, it could be like trying to protect, like a herniated disc or joint, something like that. So, we want to refrain from massage then because this might be, serving a purpose for the body. So we want to always obviously communicate, like we've been saying, have that client give feedback. And then also avoid deep, vigorous techniques and prolonged deep pressure.
Cool. Thank you. Thank you, Miss Estes. Thank you for explaining very well something I understand nothing about. Nothing. I've had many clients come to me. I cannot figure out the difference between myofascial pain syndrome and fibromyalgia and muscle soreness. Can't figure it out. I don't mean this in a disrespectful way. I just meant I'm not sure that doctors always know the difference. I think it's one of those things they throw out really quick, like, oh, you got myofascial pain syndrome. Take 2 aspirin and call me in the morning. Again, nothing to worry about. Work on these people. These are regular, tense stuff. If you've noticed everything we've studied so far, these are all repetitive use issues. Either physical repetitive use or stress, which if you think about it, stress is repetitive thought issues. You're not stressed about a variety, you might be stressed about a variety of things, but it's the same thoughts coming back over and over again. So whether you're using your wrist too often or that thought too often, these repetitive kind of things seem to really mess with people. Bodies don't like it. So anyway, very well done. Thank you for explaining the unexplainable. Mr. Brown! Mr. Brown, you were going to tell us about Osgood Schlatter disease, which is sounds very German to me.
Yes, it does. That is what I'm telling you guys about. I'm an expert now. I should get a monocle.
Oh, good. Yeah.
But
you are our expert. You're our Osgood Schlatter disease correspondent. You know how those news shows? We're going to go to Mr. Brown. So what can you tell us, sir?
So I got my handy dandy bulletin points in my notes.
Okay.
So basically, the general overview is, in layman's terms, it's a disease that causes a painful lump below the kneecap.
Yeah.
All right, thank you. That was my presentation.
Good.
No.
Okay, good. That's good. Like, could you go in a little bit more detail? But that was good. I like that you kept it tight. That was good.
It's a repetitive. So it says that's a childhood repetitive injury that I'm assuming is at the kneecap that causes a disease in the kneecap. It affects children experiencing growth spurts and who play sports and run and jump and all that stuff. So it seems like a very physical onset type of disease. And what related to massage, I couldn't find whether or not it was a contradiction. I don't believe it to be, other than the fact that it's painful. But it says that it increases circulation in the legs. I'm assuming you avoid that specific lump and just massage around it. And you treat the anterior leg and the quadriceps and the IT band, and it'll just work itself out.
Yeah. Well said. I don't even know why the book covered this. Not because it's not legit. It's totally legit, but it usually affects kids. So this is a knee, and just something for us to all think about. All four of your quad muscles, the vastus lateralis, vastus intermedius, vastus medialis, and rectus femoris, they all insert down into this thing that connects into your patella. So what's this connective tissue here called? Is this a ligament or a tendon?
That's a tendon. No.
That's a tendon.
A tendon, yeah, a tendon.
So that's a tendon. It goes in the kneecap, and then the kneecap is hooked down to your tibia. What's this in here? Is this a ligament or a tendon?
That's a tendon as well.
You could argue that, sir, but I would call it a ligament because it attaches bone to bone, the bone of the kneecap to here. But I'm being nitpicky. This is something that massage therapists do at like cocktail parties. They argue about stupid stuff like this. Honestly, it's dumb. But anyway, oftentimes, and I don't fully understand this, but like in young kids, especially athletic young kids, they get like they're growing a lot, and they get some bone growth and things like that underneath this ligament, or if you're in Mr. Brown's school of thought, tendon, that's totally legitimate too. But this ligament right here, and it wears on the ligament and can cause them some pain. And as I recall, they don't even have to they put some cream on it, and over time it goes away, or it just eventually goes away. It's not a big deal. And yeah, you can massage basically everything. You might not massage the bump, but there's no big deal. It's unlikely you guys are ever going to see this, but there's nothing to be concerned about. So far everything we've talked about is overuse type stuff, and you can massage it. Yeah, well done. Thank you, sir. You are the expert. Yeah, you get ready to go through the fascia of that chicken there and cook it up. Is that what that is?
Yeah, I was gonna make some wings, but I bought the wrong wings. I didn't buy the party pack. I bought actual wings.
Also, they're big.
They're big.
Yeah. All right. Well,
I'll figure something out. Though.
Big pterodactyl wings. You'll invent something new. Yeah, I like it. All right. Thank you, sir. Mr. Blygen, plantar fasciitis, sir. Please, I like the lighting now. Yeah.
Yeah.
And you're kind of laying on your side.
I'm side lying right now.
Yeah. Smoking a cigarette. Let me tell you about plantar fasciitis. Cool. Tell us about it.
Okay. So, plantar fasciitis. Hold on, I'm sorry.
Are you prepared, sir?
Yeah, I'm prepared.
Did you do your research?
Yeah, so...
Oh, good stuff. Thank you.
It was pretty ironic I had this one because I had plantar fasciitis before. When I was working overseas for the last 3 years, we had to wear safety boots. And they're like steel toe, and I work 14-hour shifts every day on my feet. So there was a lot of pressure and overworking on my feet. And plus, technically overweight because of the BMI ratio or whatever.
Yeah.
So that is one of the contributing factors or other risk factors that are associated with plantar fasciitis. and having tight calf muscles as well, which that is exactly what happened. I didn't know I had it until one day I woke up and it felt like pins and needles in this region, in the calcaneus part of the uh, plantar fasciitis, or in the fascia part of my foot. So it would only happen when I woke up first thing in the morning. And when I set my feet down, it just felt painful. It didn't happen throughout the rest of the day. It would only happen when I sat down for a long time or when I woke up first thing in the morning. And apparently, that is when most people feel the worst pain is after in the morning when they are in an extended period of being off of your feet. But it is inflammation of the fascia and the plantar fascia, and that is the ligament that runs from the bottom of the foot to and connects to the front of the foot. So with regard to massaging it, we can massage it. It's not a contraindication. I would just pay attention to the client to see how much pain that they can take in that area, because that's how I actually found out what it was I was getting a massage and the therapist massaged me right here. And I almost kicked him in the face because it felt so sharp. I didn't know what it was. And I thought my feet just hurt because I was always standing on my feet, but the source of the pain was right here. And so, because he was educated and he probably learned about it in massage therapy school, he said, you know what, you probably have this and go get it checked out. And that's what it was when I went to go get it checked out.
Yeah.
When I went to get it checked out, they tried to give me these splint, this little black thing here. Mine was not as bracy as this one is. Mine was more like strappy. And you're supposed to put it on before you go to sleep and basically sleep with that on. And that kind of keeps your foot in a stretch to, I guess, help reduce the inflammation in that area, to help reduce the inflammation. But this one is more intense. Like mine was like kind of cheap, the one that was given to me. And another thing that we can do apart from massaging it is give the client some activities to do when they get home, because this is something that can go away on its own with some exercises. So these little massage balls, the small one here, as well as this tubular looking one, you can do that also with a frozen water bottle, from what I was told. That can help rolling your foot back and forth on that, doing a lot of stretching, especially after overusing, like if you're doing sprints or squats or anything that involves putting tension on like the calf muscles. And that would be the way to help reduce that and actually make it go away. But because I didn't have the opportunity to kind of be off my feet for very long and do that, it kind of got really bad, and I had to get electrosis in my feet, where they took pretty much a what is it called? Like a zapper, some type of zapper, and it zapped the bottom of my feet. And it was like 15 minutes on each feet. And that really helped with reducing the pain that I had from it. And since then I hadn't experienced it, I still feel a little bit of like PTSD from it. Like when I get my foot massage, I'm like, please don't let them hit that spot. And I feel something, but I don't feel anything. I have my feet massaged all the time. So that's plantar fasciitis.
Wow. That was really good. That was humblingly good. Thank you, sir. He hit all the really big points. By the way, this is highly massageable. Massage is one of the few things that can be done for it. You will get people plantar fasciitis, inflammation of the plantar region, the bottom of their foot, and all the fascia that's on the bottom of their foot, and you have a boatload of fascia on the bottom of your foot. Your feet don't really have very much to them. The bones don't take up very much room. All the other stuff is fascia. It's meat and stuff. And I love what you said, sir. Tight calves, too much weight, and too much time spent on your feet. It's an overuse injury. And so if you're tight in your calves, that actually puts extra strain on your plantar region, believe it or not. And time on your feet is not good, and any extra weight your body has to carry is not good. So, I mean, be careful if a client walks in and you tell them all that, because sometimes they'll take it the wrong way. But the fact is, that's just for you guys to know. But stretching does help, massage does help, and as Mr. Blyden really already pointed out, the number one thing that really cures plantar fasciitis is to stop doing what caused it. Like, you've got to stop running all the time or being on your feet 14 hours a day. And by the time it's onset, the problem is people are like, they go, oh, I've got plantar fasciitis. Well, I'm standing on my feet 14 hours a day. I'll drop down to 10 hours a day. You need to drop down to like 4 hours a day. Like, it has to be a dramatic change because now it's already irritated. So when you have tendonitis, fasciitis, ligamentitis, any of this type of stuff, it's kind of like when you get, maybe not you guys, but it's kind of like when I get mad and then anything sets me off, right? Because I'm already irritated. And it's the same thing with these conditions too. So the plantar fasciitis, I get runners that come in with it all the time. And they'd be like, I've cut back my running. I was going 7 days a week and I'm only going 3 days a week and it's still hurting. It's like, you waited too long. It's so bad now that 3 days a week is too much. You need to actually be walking 3 days a week, and you need to take months and months of stretching and stuff like that for it to get back. But it is just inflammation of soft tissue. Good job. Thank you, thank you, thank you. Miss Allure, shin splints.
Okay. Okay, I have shin splits. It is a result when muscles and tendons and bone tissues become overworked. The pain is caused by the overuse along the shin bone, which is the medial tibia. And it usually happens with athletes running and jumping, or if you start a new fitness program. If the area is inflamed, it would be a local contraindication. If it's not inflamed, then just ask your client about the area for pressure.
Yeah. Yeah, in general, it responds well to massage. It's usually, I mean, shin splints can be like little fractures in your shin, but usually it's inflammation of the fascia around your tibia, your periosteum. I keep mentioning that word a lot. Anyway, periosteum, the fascia around your bones, and it has a lot of muscles that are attached to that periosteum, and it pulls on it when you're an athlete and things like that, and it can get inflamed. It responds actually very well to massage. It's on a bone, so you're going to massage it flat, right? Don't go digging into it, but you can massage it flat, and whatever the client can handle, you can do. Yeah, well done. Thank you.
Thank you.
Mr. Tate, strain. What is a strain?
Okay, so a strain is when a muscle or a tendon becomes overstretched, torn, experience a violent contraction, or synergistic failure. The most common areas where the muscle is strained is hand, thighs, back. They also are called pulled muscles. This can occur with improper warming up before physical activity or with prolonged repetitive motion. And poor flexibility. There are 3 grades of, sorry, I'm just a little, 3 grades of degree is 1, 2, and 3. While inflamed, do not treat it, and treat it as a local contraction, or contradiction. Once the inflammation is down, you can massage it to accelerate the recovery and to reduce the pain.
Yeah.
Yeah.
Yeah, really well said. So the big, like he caught all the really big highlights here, which is really good. Strains are muscles and tendons. Sprains are ligaments. If a strain is just the muscle, that's awesome. Those heal really fast. Tendons don't heal as fast. And Mr. Tate's right, you can massage them as long as they're not swollen. Sometimes they're quite swollen. Somebody has twisted their ankle and they've got a strain. You wait till the swelling goes down, but then massage really seems to help because it brings blood into that area. So nothing to
I meant to say that.
Yeah, well, I kind of feel like you did. I was just recapping.
Oh.
Yeah.
Thanks.
Yeah. I was honestly I felt like I just said what you said, but I was just like highlighting. Yeah. But that was perfect. Perfect.
I appreciate it. You help so much. Thank you.
You're so nice. Good. Mr. Riedel, epicondylitis.
Yeah, so epicondylitis is also known as tennis elbow. It's an overuse injury and comes from repetitive and strenuous movements over time. It's on like the elbow and the forearm region. Where was I? So it's inflammation or micro tearing of tendons, and deep tissue massage is very effective treatment because it increases circulation and reduces inflammation. Yeah.
Yeah.
Epicondilitis.
Yeah. No. I'm glad you stopped there because there's not much more to say about it. Epicondylitis is tennis elbow, or I would argue golfer's elbow too, and they're almost the same thing. So most of your forearm muscles you will later find attached to the condyles at the end of your humerus. These things sticking out to the side. You can feel your condyles right now, all of you. They're these. These are your condyles. You've got a medial condyle and a lateral condyle, or epicondyle, which is the tippity top of the condyle. These are the epicondyles. I don't care what you call them, but they're condyles. They're epicondyles or condyles. Doesn't really matter. They're right here. And like all your forearm muscles insert into them, so when you get forearm strain, it tends to hurt around the epicondyles. And believe it or not, the lateral one is considered tennis elbow, and the medial one is considered golfer's elbow. And in a way, they have nothing to do with golf or tennis. People come in all the time and they're like, I have tennis elbow and I don't play tennis. But they are inflammation of usually the tendons that attach to the epicondyles there. Highly massageable. Yes, Ms. Riedel.
Yeah, so I actually had it, epicondylitis. Well, I wasn't like prescribed it, but the doctor said that I probably had it from working out.
Yeah.
So you can get it from anything.
Yeah. That's a great example because it's another overuse injury, and that's why they call it tennis elbow or golfer's elbow, because it's the repetitive motion, or apparently in your case, workout elbow. Yeah.
Yeah, and it kind of like spreads down your arm too from the elbow or upwards. Yeah.
Yeah, so you can get radiating pain and problems up and down. Well said. And I also like what you said too about what the doctor said. Doctors will often, when you come in with like tendonitis-y type stuff, they're like, it's probably epicondylitis, or it's probably golfer's elbow or tennis elbow. And the reason they're saying it that way is it's not they're being lazy. It's not worth, what are you going to do? Get an MRI and figure it out right now? It's probably some inflammation, and the best thing you can do is rest it. And so the doctor knows that, and they're like, you're not going to do surgery. So they usually kind of send you away and say, take some anti-inflammatories and quit doing what you're doing for a while. That's a very common response, Cool. Mr. Placencia. Tension, headaches.
Yeah, let me talk to you guys about tension.
Oh, no, not again. No. Yeah, we can hear you, but it's that muffled inside of something. Yeah, we'll give you time. I'm gonna buy you a mic for Christmas, but early.
All right, I'm here. Tension headaches.
Yeah.
Okay, so tension headaches, hold on, where are my notes? Is basically pain in the head, scalp, or neck area, or in other words, a headache. It's the most common type of headache, the second most common being a migraine. It has many causes, and they all kind of tie in with one and each other, but the primary one is muscle tension. Elevated, reduced levels of neurochemicals such as dopamine or serotonin, anxiety, depression, holding your head in one position for a long time, so I think like a desk job, contraction of the jaw, neck, and shoulders if your jaw is constantly clenched. It's going to eventually go up to cause you head pain, eye strain, so again, being at a desk all day, lack of sleep, sleeping in uncomfortable positions, or you have sort of caffeine dependence, like a lot of people do, lack of caffeine. And contraindications, none whatsoever, quite the opposite. Massage these people, that's probably the best thing you can do for them. You're going to want to massage the head, neck, shoulders, and back, obviously, but more specifically the traps, levator scapula, the splenius capitis, and the suboccipitals, which are probably just going to hit everything, honestly, everything in that area. And apparently massage has been medically proven to decrease depression and anxiety and perceived pain in general.
Thank you very much. That was really well done. I love the stuff he said. I love how you were specific and general, because we kind of need both types of information. So he listed off the various muscles you might do, but he's like, you probably should do the whole area. And that's not half-assed thing to say. Honestly, I've got all the anatomy knowledge, but there's still sometimes I go and look at something and I'm like, I'm just going to loosen up this whole area here. Like, I'm going to hit it all. And I love working on people with tension headaches. It is so satisfying. They usually come in with a headache and they usually leave without one. You usually get instant success. It is so enjoyable. Oh my gosh, they love you, they hug you, it's all tension and stress related, so the massage is highly effective. It's not a migraine, right? And it usually goes away during the session. It is one of my favorite things. I don't wish tension headaches on people, but I wish to have lots of tension headache clients. They're awesome. And yes, you are reducing their stress, all that kind of stuff. And Mr. Placenzi did a great job of kind of showing how some of these things intertwine, right? Dopamine and serotonin is down in depressed people, and it's down in stressed people. And so massage can actually help build those things back up. Massage is a very healthy serotonin and dopamine enhancer in your body, unlike things like heroin and cocaine, which are not as healthy. So I really recommend the massage. And you won't go to jail. So, but it's very, very effective at that kind of stuff. And so yes, if somebody comes in with a tension headache, yes. And those are the people, by the way, when they come with a tension headache, I say, are we spending a little extra time on this headache and still doing a full body because I've only got 50 minutes, 60 minutes, whatever? Or is the whole session about getting rid of your headache, which means I'm not getting into your lower body at all? And if it's a bad headache, which it usually is, they go, oh yeah, whatever you got to do about this thing. And we just spend like an hour on their neck and their shoulders and their jaw and their forehead and their pec minor, right, Miss Joan? Pec minor. And then, yeah, and subclavius and all this stuff under there. So it's wonderful. It's not wonderful people get them, but it's a wonderfully, easily curable, at least temporarily curable situation. These are great clients. Okay, Miss Munoz. Torticollis. Sounds like something like with a turtle.
Yeah, it does. So torticollis, it's also known as Rye Neck. It's a condition that causes asymmetrical head or neck position. It's due to problems in the neck muscles. So some of the causes are congenital abnormalities, traumatic brain injury, non-muscular soft tissue. The symptoms are neck pain, unequal shoulder heights, thickened or tight sternocleidomastoid muscles, tenderness of the cervical spine. This is a local contraction. So once the inflammation has gone down, you can begin to massage, avoiding deep pressure and overstretching the areas.
Yeah. Thank you. I don't know if there's anything else to say about it. It's called Rye Neck. Some people call it Rye Neck. Some people even call it frozen neck. And it could be from all sorts of problems, an injury, and somebody's kind of stuck in this position. It responds actually very well to massage. There's nothing really to be, I mean, don't get me wrong, Ms. Munoz was exactly dead on. Don't overstretch, don't take somebody's neck when it's like this and just push it over there. But you can start to open it up. If the tissue allows and the person's facial expressions are fine, which is what I'm usually watching out of the corner of my eyes. I'm watching their face out of the corner of my eye, not creepily dead on, but out of the corner of my, and I'm watching their eyebrows. And if their eyebrows start to rise up too much, I know that I'm probably using too much pressure. But if their face looks pretty good still, yeah, you can go for it. There's usually some long-term shortened soft tissue there because of an injury or some problem, and you don't even have to get it back to normal, but you can bring quite a bit of relief to it just by massaging it. So it's one of those,
it said you can also do surgery, like one of the second choices or something like that. So. Yeah, you know.
You could though, sure.
Yeah.
Sure, absolutely. And when I have people all the time ask me, like, why should I do massage instead of surgery on this? And I tell them because if the massage doesn't work, you can still do surgery. Like, why not try massage for things that are soft tissue types of things? Yeah, it's just a good thing to try first. You got nothing to lose, a couple $100. and before you go cut into your neck.
Yes.
Yes. Thank you, Miss Munoz. Good job.
Welcome.
Bam. Awesome, awesome, awesome. Well, Miss McDowell, the time has come. You are going to tell us about whiplash.
Okay. Let's see a second. Okay. Hold on.
No problem. Take your time.
It's not showing, is it?
No.
Oh, I think. Oh, no, that's my whole screen. Wait. Do you see it?
Yes, whiplash. I see it, and I see somebody getting it. Yeah.
Yeah. I don't know how to make it full screen. Oh God, I should be. Thank you. Thank you.
Oh. Thanks, Gabriel. Appreciate it.
Okay, so I don't know if is it full screen for you guys?
Yeah.
Or okay.
Weird.
I can't see anyone.
This is fantastic. You're gonna have to trust that we're smiling.
Yeah. Okay. So whiplash is what I got, and as you can kind of see, there's a little preview. So basically, it is a strain of the cervical spine, usually C4 or C5. So usually happens from an accident. So sometimes like a car accident, like you get rear-ended or somebody rear-ends you, your head will go back and forth like that very rapidly, and it will cause a strain. So here's like an anatomical.
Anatomical?
Yes, anatomical.
Okay. I'm your interpreter.
So as you can see, like there's a little ligaments there of the neck. The impact makes your neck go forward and your head go back, and you have hyperextension and hyperflexion back and forth. As you can see, it can actually like cause little tears in the ligament there. So that's very bad.
Yeah, that's bad. That's bad.
It can be massaged, but only if it's not like swollen and it's like healed a little bit. It's kind of a local contraindication if it's inflamed. You can combine massage with neck mobilizations, stretches, joint manipulation, kind of increase the range of motion and quality of life. You might want to avoid the prone position, so the on the stomach, because that might overstretch the neck.
Yeah.
Also, try to avoid deeper pressure on the anterior neck and the throat, because some of those structures could be damaged. But yeah, not something that you want to have necessarily.
Not necessarily.
So, yes. Stop sharing. Here we go.
That was beautiful. So just so everybody can see, your picture showed beautifully. And this is not cervical vertebrae. These are huge. These are lumbar vertebrae, but they're the same, essentially. But you have little ligaments between all these spinous processes and transverse processes that just help keep your vertebrae together. You got muscles on them too. And in serious whiplash, you've torn some of this stuff in here. And they're ligaments. They're avascular. It takes a long time for them to heal. And you're right, just be careful. The only thing I would say is this is why we don't work on somebody who's been in a car accident within the last 48 hours. Because I don't know how bad your whiplash is, right? This is why your car has a headrest on it. This is literally 100% of the reason your car has a headrest on it is to stop your head from going back in a car accident. Because it cuts your whiplash in half. It can still fly forward, but you stop that whole huge whip thing. So yeah, you can, and I would say after 48 hours, if somebody came in, I'll work on them. I mean, if I saw obvious swelling, I wouldn't. But otherwise, yeah, you're good to go. Just be careful, gentle, check in with them, all that good stuff. Yeah. It takes a long time to heal sometimes because of the ligaments. Yeah. Don't get in a car accident. Wear your seatbelt. Yeah. Drive slow. Use your signals. All that stuff. Yes. Miss Estes.
So by us massaging that area, that's going to bring more blood to the area, right? And it might heal faster.
Yeah. Oh yeah. Plus, along with those tears, they've got loads of muscle strains and loads of other just minor problems, and so just kind of the whole neck is just jacked up. And so anything that they feel comfortable with, I would honestly say on a reasonable human being after 48 hours, anything they feel comfortable with, you can do. Yeah.
Cool.
Yeah. But you're right, there's all sorts of stuff there, and you're trying to bring blood. Yeah. And they don't usually operate on this stuff either. It's not worth it to go back in there for those little tears. They will grow back together eventually. It just takes a long time. Yeah. Very good. Cool. Miss Jung, are you there? Hi.
Hi.
Can you explain to us? We just want to know what it is. What is an isotonic contraction?
Yeah. What is isotonic contraction? It is constant tension in the muscle. On the muscle 20 lace.
Yeah.
This can happen only when muscles maximal force of contraction. The total load on the muscle. Thank you.
That was very good. So I'm going to re-say what you said, but I heard you say it. That's why I was like, yeah, that's good. So, it sounds real fancy, but isotonic contractions are what we all think of when we're using our muscle. An isotonic contraction means the muscle is under some type of tension, right? And a change in length is occurring. Now that change in length might be that it's actually coming this way, or I might be contracting and it might be going away. Now, when would I be contracting and actually having the muscle go away? Usually when the weight is too heavy. We call it a negative or whatever. Both of those, though, are isotonic contractions. There is a contraction occurring and there is movement occurring. The muscle is either getting shorter or longer, but it's trying. It's either trying and winning or it's trying and losing. And these are the contractions you guys do all day long. I am actually doing an isotonic contraction right now to lift this pen up. It's not too difficult. Don't worry about me. And I'm doing an isotonic contraction to set it back down too. I'm purposely losing to set it back down. But that's all it means. It's a muscle that's contracting and it's changing in length because it's either winning the fight or losing the fight. But that's all it is. It's what muscles do essentially. So really well done. Really well done. It must be so hard. I'm very impressed.
Some of my customers, they have like really hard on here.
Yeah.
Is that the same thing, contraction?
Well, they are. Yes, they're contracted there. Yeah.
Oh.
Right. So, I mean, anytime a muscle is hard, it's contracted.
Oh. Yeah. So how to massage?
the same June as you massage anything. You know, I mean, there's nothing different. Although I would, if you're talking about forearms, I would think about like putting them in a stretch. So if you push this hand down, that should stretch out their extensors and then tear those up. And then flex up and tear this.
Yeah.
You'll force it open. And forearms, most people's forearms can take a lot because we're used to banging our forearms around. It's like people's hands. It's hard to go too hard on somebody's hands. Anybody, it's hard to go too hard on their hands because they're used to this. Right? I'm not used to that with my face. right? So, but anyway, so forearms. Yeah.
They're usually on the
Get a
forearm,
bat.
the
Hit 'em.
inside, yeah.
Yeah, get a rolling pin, get a rock. Something like that. Okay. All right, Miss Carodi, your presentation kind of goes, in my mind, in my little simple mind, kind of goes with isotonic contractions. You're going to tell us about concentric and eccentric contractions.
Yes, I have the picture for easy and show for everybody to
I like it.
I have
That looks like my arm.
That's a isotonic contraction.
Yes.
Contraction is a concentric contraction. That means shorter time, right? Another one is the eccentric contraction. It means longer muscle.
Cool. Yeah.
So the back side get shorter for there, and the bumper right there.
Yeah.
So they're opposite.
Yeah, they're opposite.
Yeah,
So-
that's probably for them.
So concentric contractions, to any of you that are gym rats, are positives, and eccentric contractions, to those of you that are gym rats, are negatives. And so concentric contractions, I am winning the battle. That's what we normally do, right? Eccentric is when you're lowering it down slowly, or you've overloaded the weight so it has to come down slowly, or whatever, but that's a negative. You're losing the battle. So concentric contractions are you're winning, you're actually doing the curl, and then when you let the curl out, that's eccentric. Cool. Cool. Good job. Easy peasy. Really nicely done. Miss Sarno, what are isometric contractions?
Hi. Isometric.
Yes, isometric.
And the isometric contraction is the I have to show now. And when we put we put the weight like here, and we just do that. We don't move the elbow, and we take the muscle from here to in the middle of the tricep BKI.
I love it. We're getting a demonstration. Okay, cool. Yeah. So if I'm hearing you correctly, isometric contractions are where there's a contraction and there's no movement.
No movement.
Yeah. So
and just in like here together.
Right. So there's no change in length.
Yes.
Beautiful. That's it. Thank you. Yeah, so isometrics, if you push your hands, right now I'm doing isometrics. Right? There's no change in length, but I am truly pushing. I am trying. So I am contracting lots of muscles right now. Pectoralis Major, because I'm trying to do a horizontal adduction. Yeah. And anterior deltoids, because they too do a horizontal adduction. But I'm not getting anywhere. Isometric contraction, not getting anywhere. Thank you. Good job.
Thank you. And they have in the like a workout, someone build the muscle and they just length the muscle together.
Got you. Yeah? I don't know. Can you say that one more time?
At the gym, when they do the hold the weight, they just keep tight sometimes they do this way and bring the muscle in that, and they not moving.
Yes. Yeah, so that's a really good point too. In the gym or whatever, or with bodybuilders, when they are posing, they are posing by doing an isometric contraction. They're actually not just flexing their bicep here. They're definitely flexing their tricep to stop my arm from coming all the way in, right? So what they're doing is I'm fighting both. Length is not changing in both, and I'm contracting. Right now I'm contracting three muscles, right? Triceps, brachialis, and biceps brachii. Cool. Thank you. Well said. Good examples. I love that. Okay, Miss Walker, why?
Yes.
You were going to tell us about prime movers and agonists.
Yes, they're the same thing.
Thank you. I was just about to be like, and what's the difference between them? They are 100% exactly the same thing. We can use them interchangeably, and people do. So remember, we will call these things prime movers or agonists. Yeah, cool.
So prime movers are also known as agonists, and they are the muscles that cause the desired action. An example would be the Pectoralis Major, which is the muscle, it's a prime mover in shoulder flexion. Right?
Yeah, okay. I'll take it.
Was that not right?
No. It is right. I just would have, I don't know what, I thought it was a weird example they used. I would have used like my front deltoid, but they're 100% right. My upper fibers, my pec do help bring up my shoulder and shoulder flexion, so they're fine.
Also, I could have said the biceps brachii, which is also elbow flexion.
Yeah. Prime mover, like when you're doing bicep curls, that's one of the prime movers, yeah. Or agonist. Cool. And the way I remember that, by the way, is agonist. It's the muscle that's in agony. It's the one that's working, right? It's in agony. Yeah. Cool.
That's it.
Thank you. So just remember, well done, by the way. Well done. There wasn't much to say about it. Just remember, by the way, a muscle doesn't stay an agonist or a prime mover. It's described by what it's doing at the moment. So if I'm curling this massive weight right here, my biceps brachii might be the prime mover. But now that I'm lifting it up with my triceps, now my triceps are the prime mover, and this guy's no longer the prime mover. It's just a way to describe who's doing the action right then. Just like I could be a mover and help you move furniture at your house, but I'm not always a mover. Sometimes I'm a teacher, right? Okay. All right. Miss Walker T, tell us about synergists.
Okay, so synergists are prime movers, buddies. They love them. They go together. Synergists help to more effectively execute the movement of what's going on. They are normally smaller, but always located near the prime mover. And they just help. They perform like the same movement around the joint, like shoulder flexion or elbow flexion. You're always having us remember latissimus dorsi and teres major. Teres major is a synergist to latissimus dorsi.
Yeah, great example, and it was a Tapscott example. The reason I say anytime I say latissimus dorsi, you say teres major, is because teres major is a synergist to latissimus dorsi. Synergist could literally be replaced with helper. These muscles do basically the same thing as the main mover, and they are helpers. And by the way, as far as I'm concerned, I could care less which one's the prime mover and which one's the synergist. Like sometimes it's even hard to tell. I just care who's helping. They're all synergists to me if they're doing the action. But yeah, well said. So synergists are just helpers to prime movers and agonists. They're just helpers because you are rarely using one muscle to do something. Anything else, Ms. Walker?
Should there be something else?
No. I just heard like a little mumbling coming through your mic, and I want to make sure I hadn't cut you off.
Oh, no.
No, I think that was as profound as it can be.
Okay, good.
Yeah, and the example is excellent. Thank you. Miss Vincent, what are fixators and stabilizers?
All right, well, that's the same thing, fixators and stabilizers. And
yes,
as walkers, both of them just explained that muscles play different roles depending on the task at hand. And there's stabilizer muscles. So they assist the primary movers by keeping everything secure and steady. So if an example would be during a bench press, the rear delts would act as a stabilizer muscle so that for the shoulder and arm, so that the pec major and the tricep brachii can push the weight up. But that doesn't mean that the rear delt is always a stabilizer muscle. Like you were saying, if you were doing a rear delt fly, then they're going to be a prime mover and change roles.
So that was really well explained. Thank you. Really well explained. She's absolutely right. So these are more names, that it depends on what the muscle's doing that day, that moment. And by the way, anytime you're doing a movement, anytime you have a prime mover working with some synergists, agonists working with some synergists, you probably have 10 times more fixators and stabilizers helping you do that. So if I gesture with my hand like this, there are some prime movers doing that, but there's a boatload of stabilizers right there. My rhomboids had to lock down, my traps had to lock down, my rear deltoid had to lock down, my front deltoid, anterior deltoid had to hold my arm here and stabilize. Stabilizers are everywhere, and it's kind of a big new thing in personal training now too, where they do lots of exercises that stimulate stabilizers. So they have you stand on those squishy balls while you're holding the weights, and things like that, because what it does is really emphasize your stabilizers, because they realized that if your stabilizers are strong, you're actually, it kind of increases your core strength in general and how you're tied together. So stabilizers and fixators are really important. And they're also things that stop unwanted movements. Because remember we talked about like diagonal muscles and how do I sometimes use them to go straight and not diagonal? Stabilizers and fixators stop the unwanted movement. Stabilizers and fixators stop unwanted movements. So sometimes turning a stabilizer on all of a sudden changes an entire movement because it stops your arm from going over this way, and now it can only go up. Stabilizers and fixators. Very, very cool. Ms. Routson, last but not least, antagonists.
I'm so excited you gave me this one because I answered it wrong.
You answered it wrong?
On my test. Yeah.
Oh, on your test. Okay.
I had them backwards, so I'm glad we did.
It'd be easy to do.
Antagonists?
It's easy to do.
Antagonists are the muscles that lengthen while the synergists and prime movers are shortening and contracting to make a movement. So typically these muscles lie on the opposite side of the moving joint. But just like Mr. Topscott said, they trade places depending on what movement we're doing. So it is not always an antagonist.
Yep.
I have kind of a hard time reverbing it in my own words, so
well, you nailed it.
A little bit concise.
You nailed it.
Examples
Oh, go ahead.
would be like the way the quadriceps work with hamstrings. And in our arms.
Yep.
Are the biceps brachii and the triceps brachii ever in
They're always antagonist agonist to each other. They're always.
Okay.
They're role switch, but always one is the agonist. Because always one is shortening and the other one's lengthening, or the other one's shortening and this one's lengthening all the time. They can't help it. And when you said the quads and the hamstrings too, yeah, all day long. They're antagonists and agonists to each other, and it just depends on who's working at that time. So the antagonist is the muscle that's lengthening while the other muscle is shortening. It's also, by the way, another way to look at this, everybody, is antagonists are the ones that can stop the movement.
Okay.
And why I think that is important is sometimes, like if I'm having a hard time pulling my arm in like this, that might be because my biceps not working well. But quite often it's because there's a problem with my tricep elongating. And so sometimes as massage therapists, especially in sports massage, we look at antagonists. And there's a big beauty to this. We'll go on break in 2 seconds, I promise, but there's a big beauty to this. And that is, if you have antagonists in your body and you're an athlete that are holding you back, and I release those or loosen those muscles up, you get instant power performance. You didn't get stronger, but you have less stuff holding you back, so it seems like you're stronger. So we can actually get you to instantly jump higher, run faster, things like that, if you have antagonists that are holding you back, and we lengthen those, we loosen them up, we get them out of your way. Right? So if I've got an antagonist on my little Honda Fit that I drive around, and it's a trailer, and you unhook the trailer, all of a sudden I'll be like, wow, this car's got a lot of pep, right? The car had the same amount of pep it did before. I'm not pulling a trailer anymore. So it's just a very neat thing, and it's a concept we will use later. Quite often we are looking at antagonists because they are causing problems with holding back the athlete or stopping the movement that a person is doing. So we're actually quite often, strangely enough, we care about actions, but quite often it's the muscle that can stop that action that we care about even more. So that is a great place to stop. Very good job. Thank you, Ms. Routson. Thank you, everybody. Thank you. Thank you, thank you. It's not an easy thing to do. I know this is not an easy task too, because I give you no guidance on it, right? I'm like, tell us about fixators. And you're like, what about it? I'm like, do it. And I think you all made really good selections on what you told us about, so I really appreciate that. And some of you did it in a language that was not your own. I still think that's really amazing. Just the guts alone, it's amazing. And for those of you, I hope you recognize that those of us who are native English speakers had a hard time with these words and things like that. So anyway, let's all take a well-deserved 15-minute break. I'll see you back at 5 o'clock. Thank you.